Okay, and the last in the series of my lactation gadgets is going to be cooling packs. So cooling packs are on the market. You can find booby tubes, all kinds of, there's Lancet, there's so many on the market right now, specifically for the breast, for engorgement, that sort of thing. So you can buy those booby tubes. They're soft, they're fantastic. You can throw them in your freezer right now. You can buy any kind of cooling thing and just throw it in your freezer and forget about it till your baby comes, or if you need it. You can always keep some sweet peas and any kind of corn, anything that's kind of moldable, and that if you end up not needing it, you can eat it later. So there's another option. So they're just cooling packs sort of like that are great to have on hand and ready to go in case you all of a sudden get some inflammation in your breast. So that could be a plugged duct, that could be some redness, maybe turning into mastitis. So mastitis just means inflammation of the breast or the mammary tissue. So itis just means inflammation of. And in every other part of our body, when we're inflamed, say we twist our ankle, what do? We grab some frozen peas or something cold to put on it to reduce the inflammation. So the newer protocols for all kinds of mastitis related issues is saying to avoid heat and really focus on cold, because it's the inflammation of the tissue and the ducts, all of it is inflamed and getting bigger. We want to do the opposite, which is ibuprofen, if you can take Motrin or something like that, but also some cold packs and cold therapy. So cabbage leaves is on there just because, not because there's anything special in cabbage that they found, but just that it's cold and it can wrap around your breast really well. So I would wash it off, in the sink, put it in like a little ice bath too, and then kind of crush the stems a little bit. But then it does fit around your breast really well. But if you don't have any cabbage leaves, don't want to use cabbage leaves, you can also use these frozen peas or these booby tubes or an ice diaper. So remember when you're in the hospital, if you've been in the hospital yet, or if you have, you can take a baby diaper, open it up, and then fill it with ice. We would kind of fill it with crushed ice, and then we would fold the end of the diaper over, kind of like you would with the baby, and kind of Velcro it. And now you have a nice rounded baby diaper that you can put on your breast too. Alternatively, you can fill a couple diapers with water and then just stick them in the freezer and forget about them too, in case you need them. And the nice thing is when it thaws, the water just soaks up in the diaper. It doesn't go anywhere. So it's not like having like a baggie of ice on your breast. So just if anything like that does happen, I'm getting a sore spot, I'm getting some redness, I feel a lump in my breast and it kind of feels like a plugged duct or something, the first thing to do is to grab some ice or some ice like therapy and put them on your breast, and maybe some ibuprofen as well. And remember, again, just very gentle massage. Don't go too crazy or too forceful on your breast, because that makes the inflammation even worse. All right, I hope you never need any of these cooling pack situations, but if you do, please reach out. We can talk in person, we can talk on the phone, we can do a Zoom. We'll get you through it. So you hang in there. Thank you.